A warm welcome to all our viewers to our series Natural Medicine. I've now been allowed to do 2,500 interviews, and so far I've missed one person to interview here. And you definitely know this guest. And I'm glad he's here today. Stay tuned, we'll get started right away. Here we are again, and now I can introduce you to the gentleman whom I've personally been following for 25 years, and hardly a medic who has already been here does not quote my guest. It's Professor Dr. Thomas Rau. Welcome to our studio. Now, your name has become really big. You've built up a huge clinic over decades in Switzerland, which has actually been visited by the whole world. This is the Paracelsus Clinic in Switzerland. What you've built there is gigantic, and how did it actually come about? Can you tell us a little about it? How you came to this clinic, how small was it, and did you start it from the beginning? Thank you very much for your invitation. You've already invited me several times, but I'm happy it really worked out now. Yeah, I'm happy to speak to the audience, and this question is actually not the most important question about my career. Well, I learned the usual academic medicine. I'm actually trained in rheumatology, but I hadn't quite finished my specialist doctorate, but then spilled over to internal medicine. And that was my academic medical training. However, it was a long time ago, but it is very good. And then I also practiced that, so to speak, general internal medicine and rheumatology, and was allowed as an almost embarrassing youngster to take over the management of a health resort. That was a gift from God. So I was able to gain a lot of experience in rheumatological rehabilitation. More and more seriously ill people came. Even then, that was in the 80s, so it really was a long time ago. And then I found more and more that despite my good knowledge of academic medicine and therapies, I think people actually didn't get better. They got better for a short time and they came back every year. Why are they coming again? Because they're just not well. That was an impression that shaped me. And then more and more patients, a doctor has to listen to their patients. More and more patients told me, you know, Dr. Rau, now I'm feeling better. And then I asked the question that unfortunately most doctors don't ask, what did you do? I've deacidified my body. What? Deacidified? What's that? Doctors don't know that at all. We haven't learned such things, despite our specialist medical training. And so it happened then that I asked. I remember one case. What did you do? Deacidification? What is that? That was with Dr. Such and Such in Salzburg, and I've been doing better since then. But he was already with me 3 times before, and it didn't really help much. Sorry, but then I did something again that I've been doing for decades, for sure 20 years. Namely, I then asked, who is this doctor? Dear colleague, we have a common patient, Ms. Such and Such, and you were able to help her. What did you do? I deacidified her. Yeah. Can you tell me what that is? All questions that are actually unusual for an academic medical colleague. And so I went to see him. That was Dr. Wertmann in Salzburg. And he shaped me extraordinarily, because I only saw difficult cases with him and asked around in the waiting room, and people just felt better. What did he do? But that was only one person who has fundamentally shaped me. My dear friend Conny Wertmann in Salzburg. I just mentioned him, but afterwards I was allowed to go to other colleagues, and they made a great impression on me too. And it became more and more clear to me that you have to do other things. From the beginning, you were always a curious person with an urge to heal. And you actually never said, academic medicine trained to me. That's the dogma. I know everything, because I hear that very often from young doctors, that they really have the urge or the opinion to know everything. But it's actually just the beginning of a long journey. And your journey has been going on for decades, and of course, your knowledge is incredibly great. And I know a lot of great doctors, and they've all been with you. I am an open person with big ears. Not anatomically, but otherwise big, symbolically big eyes, big ears. And I'm just open. And then I have something else. And now we come to the Paracelsus Clinic. I have a strictness. And I've had an insistence for 40 years, for 30 years. 30 years ago it was pretty much exactly 30 years ago now, I was allowed to join the Paracelsus Clinic, which was founded by Dr. Winkelmann. He was a very charismatic alternative practitioner, even got an honorary doctorate and was very charismatic. And he introduced this old-fashioned humoral therapy and was very, very successful in the Paracelsus Clinic. But then in 1981 it was dusty, I have to say. He died a few years earlier, and his two daughters continued to run it. Fascinating that they managed to do that at all. They did it very well and then looked for a successor. And then we could get in, and in 1992 we could buy the clinic. And I did that with 3 partners. And they weren't doctors. One was a dentist and 2 were business people. And they set up the Paracelsus Clinic with me. I was the specialist, of course, but I always had dentists with me. Maybe we can talk about that later. And that's how we built biological medicine. The title of biological medicine it's not defined. I call it that. Now, quite a few people call it that. There are even others who even shaped this title in books. I think the University in Milan is even training in biological medicine. Exactly, but that came later. But they still do, an apprenticeship and a master's degree. For example, my colleague Wickel did that, and a few others that I really value. It's a good thing that it exists. In any case, we then took over the Paracelsus Clinic, and it was always absolutely clear to me, I do this biological medicine and nothing else. Perhaps we can later speak about that. It is a broad-based medicine that directly affects the metabolism of humans, right into the cell. I did that and have done it for over 30 years now. I just continued to develop it together with many colleagues. That's why I know so many colleagues, because many colleagues have also wandered through our clinic, such as Wickel too, Dr. Utzmeier, or many others who are now very successful biological doctors. It was like training. You had to have been to Mr. Rao's Paracelsus Clinic once in order to carry the knowledge out into the world. It is important to me to carry that out. There is something else. I get asked again and again, you know, Thomas, what are you actually doing? You say everything that you know in your seminars. Yes, of course, I have to pass it on. This is my duty, not just treating people. No, I have to pass this on to others, and please, copy me. I'm not afraid if I'm copied, because until the other one copied me, I'm already 3 steps further. That's no problem, because we are always trying to develop further. Technically, but also medicinally, and in orthomolecular medicine and so on. There are so many new developments and research. Today, I can proudly say that biological medicine is biochemical, pathophysiological medicine, based on the basis of science. We are scientific. And if an ignoramus tells me there is no study, it's not scientific, then it goes in one ear and out the other. Because we are based on knowledge that is really based on cellular metabolism. The lobby behind it is just still small, isn't it? It's still not a university education, but we already know it is just a difficult process to transform this health system. Yeah, this topic, you have to be careful not to become polarizing. So, I don't want to polarize too firmly between academic and biological medicine. We are simply the basis of medicine. We're not complementary. Academic medicine is complementary to us, because I change a person's metabolism so that they can change again, to regenerate their cells anew. In 7 years, all of your cells are completely renewed. You have to make the new cells better. And how do you ensure that the new cells that are formed, even at my age, I'm not the youngest anymore, that they get better? I always ask myself that too. If someone has a tumour and you know that within 7 years the whole body will be rebuilt, why should the body build the same things over and over again when they're bad? So it is logical that somehow, if the body is strong enough, self-healing can be there to stop building this tumour, for example. Exactly. That is an epigenetic question, which is also known scientifically today, that for tumours that arise due to epigenetic influences, the gene information of the cell, this cell number 1 of the tumour, changes. What are the epigenetic influences? But that would be a lecture in itself again. These are toxic influences. These are nutritional influences. This is electromagnetic pollution. This is now, for example, the 5G and so on. Without becoming polarizing again, but there are a lot of influences. And if you don't change this, then you will never be successful in tumor therapy either. And I just said to myself, we know so much. We practice and implement it in our medicine, then it works. But the patient has to participate. They have to change their diet. They have to be ready to detoxify. They just have to make a certain level of effort. Yeah, at the beginning, to see where they are. We're not treating the diagnosis cancer or polymyalgia or who knows what. I always treat the individual human, fundamentally. And if someone has polymyalgia or polyarthritis or MS or whatever, they don't have the same causes, like when someone else has that. And we have to clarify these causes. I never deal with diagnoses, I always deal with people. Maybe something on the side, I think you know that too, but in the last 20 years, your name has come to me very often, so often. And it was again and again mentioned by seriously ill people who said that only Thomas Rau can help them. People who just didn't know where they were going, just came to Paracelsus Clinic. Thomas Rau, that was simply the premier class in the last 20 years. That's how it was brought to me. And when I've been abroad and asked the same questions, it's just unbelievable. You managed to get an international awareness. Thomas Rau, that's where you go when you're seriously ill. How did you do that? Was that just the success that proved you right? Did you have the right patience to carry this into the world? How did it go, this marketing behind your success, far beyond the Swiss national borders? I was allowed to treat a patient who was the Crown Prince of Saudi Arabia at the time. I am also allowed to say that. He came for a few years, was then murdered later, but came to me for a few years because of a serious illness. And then, even with His Majesty, a comradely relationship developed. After about 3 years, I asked him, "Your Majesty," I was very formal, "why are you still coming to me? Why are you sitting in my waiting room? Why are you no longer coming with bodyguards, but wearing blue jeans now?" Then he told me something very important, and that is the answer. He told me, because you are authentic. Because I realize that you are treating me as a person, and not as the Crown Prince of somewhere. I don't care if that's who he is. No, it's not that I don't care, of course, but I treat them the same as a street worker. Because I treat the human. And if you do that, and if you are strict, I've also told my patients who have confided in me from the beginning, if they don't get involved, then I'm of no use. Then they fail and go to someone else. I never let myself give in to patients who then just didn't want this or that and go somewhere else. I have a waiting list, and I also teach that to my colleagues. Not my students. No, they're not just students. These are friends and colleagues. I always teach them, be strict and persevere in your line. Nothing else. And that's why people come to me. And we just have a medicine that is approaching the metabolism, the human system, in a completely different way. I can explain the 3 pillars later. My 3 pillars of biological medicine, fundamentally different, so that I can change uncontrollable diseases and can have success there. And I always carried it out, quite modestly, I can say, taught in seminars. I've been allowed to do seminars all over the world. And that's why I got patients from all over the world. I am always amazed when I have such a famous doctor sitting here again who tells me his biography. And most of them were with you. Yeah, that's true. Kurt Mosetter, for example, he was with you, wasn't he? Yeah, Kurt Mosetter even worked for us. Yeah, a very good one. And also someone with big ears and big eyes and an open mind. A fantastic biological practitioner. Well, he's doing myoreflex therapy now, his neurological stories. But actually, he's doing some very similar things. It's great. Thank you for bringing so much knowledge out into the world and not keeping such doctors to yourself. Because that is something that is honourable, chivalrous. Something that cannot be taken for granted. For you, it is a given. But I have to say, I didn't develop that myself. I just brought the pieces of the puzzle together. But I got it from others too. So, it's not my medicine. I just described it a little better than the others, maybe. But that was also in the Hippocratic Oath. Somewhere, wasn't it, that you help each other and do further training, right? Somehow I read something there, still from Hippocrates, that as a doctor, one really sees that knowledge should be passed on. But anyway, now back to Thomas Rau. What are you doing today? Because I heard you built a new clinic, 2.0, where something revolutionary has been introduced in the field of nutrition. And I think a lot of people don't even know that yet. What has now emerged in Switzerland? Therefore, I'd like to ask you to talk about that too. Yeah, the background was that the Paracelsus clinic just took a different direction. One thing led to another, and the ownership was changed, and it is now under Chinese ownership, unfortunately. And then the direction has changed. And because I am strict and persistent, I said, then I won't do it anymore, then I go. And I left, and I think 15 people came with me. They too see my medicine in this way. Together with my team, I created a boutique, so to speak. I know when I say boutique, nice name, then people always think that it is very expensive, like a Rolls-Royce. No, it's just Rolls-Royce quality, but not in any other way. A clinic where I provide nutrition, human rest, in an extremely beautiful environment. We had the opportunity to take over a health resort, which was built to the highest standard in 1996 and was closed. I was able to take that over here in the area, a place in the foothills of the Alps. Schwelbrunn in Switzerland. We were able to take over the Sonnenberg clinic. We rebuilt it. Well, rebuilt, we just converted one floor and an annex building into therapy rooms and doctors' rooms, and can now offer all the therapies. What do I do with the diet? I finally have the opportunity of bringing in my diet and giving it to the people. Similar to Al Ronc, for example, they do that too. And with us, it's even stricter, I would say. And how do I do that? I'm not a chef. I know what to eat, how your diet should be. I also have my colleague who will also speak here. I took her with me, and she's even stricter in regards to diet. And meanwhile, we have also found out that proper nutrition is actually one of the most important things for the chronically ill person. They just have to take action themselves. So I asked the brothers Frey from Tibitz. Tibitz is well known in Switzerland. There are 12 restaurants, vegan or vegetarian restaurants in the cities. I know this family, this institution, and also Hiltel in Zurich, and I asked these people, don't you want to set up your first vegan hotel with me? A wonderful hotel in the most beautiful location. You can't have it nicer than us, with a mountain view and so on, lake view. And don't you want to build a Tibitz hotel? No, and such. Please, I'll bring the patients. And so one thing led to another, and now we've done that. This is really unique in Europe. There is not yet a hotel with this strictness that makes vegan haute cuisine, you could say. And at the same time, we have our biological medicine, and in a logistically very good location. So we are 1 hour away from Zurich Airport, 20 minutes from St. Gallen. Go online and have a look. www.biomed-sonnenberg.com. biomed-sonnenberg.com. Then you see the house. How many patients fit? It depends. We have 18 rooms, no, 16 double rooms, large double rooms. So there can be 32 people, but we always have a large number of outpatients. Also, yeah, of course. So numerically, I've got about 60% outpatients and 40% inpatients. They come from everywhere, from Stuttgart, from Zurich, from Gallen, from Herisau. I also have a lot of people from the area, like a family doctor. Yeah, understandable. I mean, 40 years as a doctor, or 45 years. Exactly. Is it correct? 45 years? It is exactly 40 years that I have the license to practice. Impressive life's work, what you've built there. Dear Professor Dr. Thomas Rau, very, very impressive, and thank you for describing it to me. And in this clinic, in this new story, I also wish you the great international success that you will definitely have. I've no doubt about that, because your name is really the guarantee for outstanding medicine at the basis. And if the patient is also contributing to it, then they have a great chance of really finding their balance again. And it's really a great honour for us that you were here today. Thank you. Thank you very much too. Dear Thomas, I'm not going to let you go so fast. We'll do another show while you're already here. And to you, dear viewers, I hope that you also enjoyed seeing who Professor Dr. Thomas Rau is, what made him, what he achieved within medicine. And I can only hope with all my heart that people like him really have the chance, have the opportunity to pass on their knowledge at a university, so that a broad mass of doctors can already familiarise themselves with applied biological medicine, so that everything is interlocked and the patient ultimately always has the chance to experience a complete holistic medicine. I wish that with all my heart, of course, for all of you, our benefits. All the best, and see you next time.